We'll go to our third speaker, Dr. Joanna Shaw-KaiKai. She's an infectious disease physician, formerly of Meharry Medical College, and now with the Metro Public Health Department of Nashville, Davidson County. She serves as Associate Medical Director of the Communicable Disease Control Bureau. Joanna.
Thank you. Thank you for inviting me to speak. I tend to speak softly, so if you need me to speak louder, just let me know. So I bring you greetings from Nashville, or as a gentleman recently told me, oh, you're from Nash Vegas. And I said, excuse me? And he said, you know Vegas, Nash Vegas? I'm like, okay. Pointed. Am I pressing the right one? Okay. So as far as financial disclosures, I have none. However, the health department was selected to be one of those health departments to participate in the NACHO STI Express Data Collaborative Study in 2019, and that comes with, I believe, a $30,000 funding for our STI clinic. Or we've been rebranded due to the end of the epidemic work in Nashville to now Sexual Health Center. So Nashville has had an economic boom over the past few years, and so the population has increased from 600,000 in 2010 to almost 700,000 last year. The demographics, predominantly Caucasian, African Americans make up about 30%. Hispanics, sorry, that should be 10.5%. And females a little bit more than males. Nashville, we have more than 20 four-year colleges and universities, and about 18 community colleges and vocational schools. So we have a lot of young adults in Davidson County. As far as our sexual health center, we see about 8,000 patients a year. Most of those are through our sexual health center. We do have a few patients that are seen in our family planning clinics, and they're located about 15 minutes from the main building, the Lens Center that you're seeing in this picture. And of those who have visited the Sexual Health Center in the past 5 years, predominantly males, predominantly blacks, African Americans. And as far as the makeup of the Sexual Health Center, we have one nurse practitioner, two nurses, one medical assistant that does mostly the fast track system, in which people who come in who are asymptomatic and just want screening, she'll draw their blood. We have an infectious disease physician, that's me. For those who know about the local health departments, you wear many hats, so that's just one of my hats. I tend to come in and help with the complicated cases, or those private physicians that are giving us a tough time. They'll usually come and say, hey, can you come and speak to Dr. So-and-so? I'm like, oh, goodness, but I do, and we usually can smooth things over. We have right now 5 DIS, and I'm happy to say this is the first year in a few years that we've been fully staffed as far as DIS. We've had a high turnover. They usually have retired, or they've moved on to some other agency, usually a private agency that's paying more money. And we have 2 intervention specialists. As far as the billing, we bill currently only TennCare. We charge for those who do not have TennCare, which is the majority of our clients. The testing is $10. However, if the person does not have the money, we do not turn them away. We'll say, okay, next time pay, and then the next time pay, and it just goes on. So basically, we don't charge people. HIV testing is free. We have on-site trick testing, RPR, and also the oral HIV testing. Our labs are processed through the state of Tennessee labs. Usually and they will upload them into what's called PITMS, the electronic database, within 3 to 4 days, and we also get hard copies. So we have many patients who English is their second language, and we're happy to say we have an interpreter service that's available by telephone, and we have over 200 languages that are available to us. And I'm happy to say I've been to the health department now about 3 years and been trying to get us on with PrEP. And this fall, we should open our PrEP clinic, which will be through the Lentz Center, or our sexual health center. We have one case manager and one nurse practitioner who signed her contract, I think about a week and a half ago, so it should be great. The funding is through the state of Tennessee Health Department. So similar to what others have talked about as far as the STIs we're seeing, chlamydia is number one, and for our patients, females more than males, especially the Black females, and it tend to be within the younger age range. We actually had at one of our colleges last summer, there was a pocket of students who, I mean, it was almost every test was positive for chlamydia. What usually happens at the beginning of the school year for the colleges, they'll invite us to come and do screening, and so this one school had a whole lot of chlamydia cases. We're still trying to get in with them, and we can do something more sustained and come back instead of just once a year to do screening or at their health events. Gonorrhea, Black males, and also we're seeing them in MSMs. Syphilis was plateauing over the past few years, but then we're starting to see a trend upwards. We haven't seen the numbers, the hard numbers, but the actual, just based on the number of people we're diagnosing, we're concerned that that trend is going upwards, excuse me, in males more than females. As others have said, we've seen a decrease in HIV incidence, but still the highest rates are in Black males. So what are our challenges? As others have said, funding. Unfortunately, this year, for the 2019-2020 fiscal year, we did experience a cut in our STD prevention funding. Luckily, no jobs were lost, but there were plans to increase the number of DIS, but that's on hold. There's distrust of the healthcare system with some of our clients. It was, I think a few months ago, I was in the clinic, the sexual health clinic, and talking to the nurse practitioner, and I heard screams coming from one of the rooms, and I know a nurse was in there with a patient. So I ran to the room, and there was a lady in there. The nurse had the Hep A vaccine about to give the patient, and the patient was just screaming. And so I asked what was going on, and she said, "I don't know what all you put in this vaccine." And it's a single dose administered vaccine, so the nurse was not having to manipulate the vial or anything. And she said, and I said, "Well, ma'am, you came to us to give you this vaccine due to the Hep A outbreak. We haven't put anything into it." And she said, "Well, I know how government is, but we managed to calm her down, and she got the vaccine. And then she went out to her partner who was waiting and said, "Well, your turn. I hope your vaccine will be okay." So we have to deal with that. We're seeing an increased number of private facilities that are screening for STIs in addition to other services, but the patients cannot afford the treatment, so they'll send the patients to us. What we're finding, especially one of those agencies that's doing a lot of screening, is that the patients, for whatever reason, do not trust us. So I know our STD program director has set up a meeting in the next couple of weeks for us to talk with this agency and so we can work together better. For our patients, it's transportation. I know some cities like ours are experiencing gentrification, so patients are having to move further out and they can no longer afford the city proper, and so transportation becomes an issue. What we're having to do is to, as always, be kind to our fellow divisions and ask them to borrow their vehicles to go and get that pregnant lady with syphilis who her private provider hasn't been able to get her in for the 5th time. The person who has limited access and is on dialysis and all that, get that person in. Work hours. We actually did a survey to see what hours would work better for our patients, and I was surprised. I thought they would say weekends, but it was early morning. And we've tried to work on that and offer a lot of early morning appointments, but then we get a lot of no-shows or they come in the afternoon. So we're still trying to work on that. Parents of minors, this is one complaint the DIS have, because they'll get in contact, try to get in contact with the patient, and you have to go through the parent, and the parent will say, well, you have to tell me or else you cannot speak to my child. So working on that. I mentioned the college students, a lot of them return home or go on trips for during the holidays, and it's hard to get in contact with them. So what are we doing to meet these challenges? We're offering evening clinic once a week at this time. We started a fast track service because we were having a lot of calls to the mayor's office that people were waiting 3-4 hours to be seen for an appointment. And so those who are asymptomatic can just come through the fast track service for the screening. They do not see a nurse practitioner at that visit. We started a results line July 2018, so people are now waiting hours just to get their results. And we started an appointment-based system in October 2018 that we're still tweaking. It does allow for walk-in, for people to walk in, and we also have slots not only for the medical providers, but also for our DIS staff, so they're not running into each other's times. Trying to collaborate with other programs for use of their vehicles. We have free bus passes we can give our clients. As I mentioned about, okay, next time you pay that $10. There's no patient that's refused care. And then through the Johns Hopkins program this past spring, we're able to offer the expanded role nursing training to about six of our nurses. So now they can go and do their, now covered to do pelvic exams. Prior to that, there was only one in the state of Tennessee who had that expanded role training. Talked about the survey regarding hours. And so what are we doing? EPT in the field. That's a discussion we're going to be having with DIS and making sure they're comfortable. Currently, DIS are not, some of them are not comfortable with that idea. And also not only having the DIS at our primary center, but also going to the 2 other family planning centers and being there so clients don't have to drive across town. We were hoping with that we could, with the new positions we're adding for DIS, that would be possible, but we'll still look into that despite the cutting of funds. We're trying to meet with some of the colleges and universities to work out more sustained plans for STD screening and prevention education. Also, I mentioned we're meeting with that private agency regarding their clients and all the STI testing they're doing. And then the use of social media. Social media was very helpful when we began the outbreak management of hepatitis A last year. And so looking to expand that to our DIS area, and also just trying to get the word out there about STDs and STI education, prevention. So that's an area we're looking into. And thank you.
Thank you very much. Very helpful. Thank you.